I have 3 kids.
Yes.
We are expecting our 4th child this fall.
So many.
Let me just ask the mothers out there, do you ever feel like people all around you think that you should be fully recovered just a little bit quicker than you actually feel up to after, I don't know, creating another human life?
It's a big deal, people. Typically, it's 6 to 8 weeks before moms get the all clear, but a group of physical therapists says not so fast, and I like them. In today's Be Well with TCL, Kelly shows us how motion is helping women get back to feeling a little more like themselves.
I have 3 different exercises in mind that I can show you that will help you to relax your pelvic floor, contract your pelvic floor, strengthen your pelvic floor, and then we can kind of show you an exercise that incorporates those 2 things.
I'm a mom of 2 little ones, so I know what it feels like to be told at 6 weeks postpartum, you can get back to your pre-baby routine.
A lot of women are expected just to bounce back, and that's not the case for most women, is it?
Right, yeah. I mean, a lot of women kind of feel this pressure, like, oh my gosh, I need to get back to my pre-baby body. I need to feel 100%. I need to go right back to work. And it's not necessarily the case. I mean, you're carrying a baby for 9 months. That's already really difficult. And then you deliver a baby. You definitely don't feel completely normal.
Jennifer Jocelyn is a pelvic floor physical therapist at Motion.
It's not just Kegels.
Exactly.
That you have to do.
Yeah. I think there's a misconception that all I do is just teach women how to do Kegels, and it's so much more than that. If you have back pain, hip pain, it can be related to your pelvic floor. Some women have pelvic floors that are very tight, and that's what's contributing to their symptoms. So sometimes you have to learn how to actually relax those muscles first before you can start strengthening them. As you look up, you're going to inhale and just let your belly relax.
So these are things you can do at home.
Totally.
In the past 40 years, there's just been this understanding that it's a 6-week postpartum check. By the time you've gotten through your 6 weeks, physiologically and physically, you're back to normal. And so the expectation is, I'm back to normal. And that obviously isn't always true.
Dr. Matthew Weinrich is one of several physicians from OBGYN West that collaborate with physical therapists here at Motion.
And a lot of these things are just temporary, they're transient injuries that take time to heal, but wouldn't we want to be proactive about that instead of saying, well, it'll get better over the next 6 to 12 months.
We're really thankful for our partnership with OBGYN West because it allows us to have that direct line of communication. And so if I ever have to ask a question or refer a patient, they're right there, right down the hallway. What I want you to do is take a big breath in for me and focus on breathing in through your belly. Nice, and then exhale.
I had my last baby 7 years ago. Jennifer says pelvic floor PT can help every woman.
I treat women of all ages, and just because you had a baby 20 years ago doesn't mean that you're not postpartum anymore. We're able to help you regardless of your age.
Oh man, I just really love that picture of you and Quinny, Kelly. So Kelly's here, and I love this that the physical therapists at Motion say, they're really saying the US, the United States as a whole, we're really behind the times when it comes to PT and childbirth. That in other parts of the world, this is a given.
Yeah.
And for us, it's like this seen as this revolutionary thing.
In Europe, if a woman comes at her 6-week postpartum appointment and is presenting saying, I'm leaking, there's incontinence, I'm not feeling like I should, they are referred to a physical therapist for pelvic floor physical therapy, which I did not even know existed.
No, me neither.
Didn't even know it was a thing. And they're really, the exercises I did there are things that you can do at home. So it's not going to be, I have to go every week.
Sure.
You may have to go every week for a couple weeks
to
get those skills down, and then you can take it home with you.
Surprising too to hear that it works, even if you had a baby, a couple decades ago, still is helpful for you.
Right. I had a baby 7 years ago. Women though come in that are in their 70s come in and say things just haven't been right since I had my child 50 years ago.
What's with low back pain? That could be a sign of some trouble with your pelvic floor?
So what was interesting during these exercises, I was so tense, and she's like, just relax your body. So if you're tense most days, it's because you're trying to work through that pelvic dysfunction, holding everything up and together. So the lower back pain could be an identifier of the pelvic dysfunction.
Well, I mean,
it's
we
really
don't call her
interesting.
Dr. Hansen for
She's
nothing.
a
The way
doctor
she
on
talks
TV.
about this,
Kelly,
it's like
thank you.
she should have an honorary MD.
Drop the script.
Yeah.
A big
Thank
thanks
you.
to Motion, by the way, for sponsoring our show today.
In addition to their satellite office at OBGYN West, Motion has offices in St. Paul and Minnetonka. And to learn more about their physical therapy services, just go to our website. It's twincitieslive.com. Really interesting.